Hello, I'm Paul Turner. I'm a practicing osteopath and I've been in practice since 1993, and I've been involved in teaching and education since 1996, mainly in the areas of anatomy, integrated assessment, sport injuries and rehabilitation, and also clinical supervision. I've also written a book on holistic assessment called Bridging the Gap in Healthcare, and also have a very big interest in promoting holistic assessment in all the different health fields. And the reason that this is important is because no matter what way each professional decides to assess their clients, it's basically the same patient that we're all assessing, and that patient is made up of lots of different aspects. So it's the same patient, yet each practitioner will assess it from each perhaps different angles and therefore pick up different information. So it would make sense therefore to treat on a holistic level, so that we can all work together and generate increased health and well-being within our clients. Also, one other thing I've noticed in all my years of teaching is that the students in the clinical supervision tend to have come across constantly the same issues, and that is that they always have trouble seeming to put the whole picture together. So what I'm going to try and do in this video series is try and slot in that missing element and try and help the practitioners and the students to try and put that missing element back in and integrate the whole assessment process. Now, to do that, I'm just going to go through with an illustration of the different steps to see if we can understand what it is that's missing. Now, throughout our studies as students, we learn a lot about the anatomy and the physiology of the body. We learn a lot about the basic sciences, about common injuries and disorders that a person can suffer from. And practically speaking, in order to provide a successful treatment, we have to follow basically 5 steps. The first step is to actually follow an assessment process. And this is usually taught quite well in most colleges, although there is a tendency sometimes to skip over the general assessment and just look at regions where the pain is focused. So we want to try and avoid that a little bit and get back to the whole person. The second step is to be able to gather meaningful clues from that assessment process. The third step is to make sense of the clues and order these into some sort of a pattern. Okay? The fourth step is to express and explain this pattern of dysfunction and form a working diagnosis so that we understand what's happening, we can explain it to our colleagues and also to our patients to help them understand what's happening in their bodies. The final step is to actually implement the correct treatment and technique. Now, this is also covered very well in most colleges because we learn a lot about treatment techniques to address specific dysfunctions. And same with the point 1. It's the 3 middle points that students in clinic tend to have trouble with when it comes to the crunch. They know they have to assess, they know how to treat, but they don't really understand what's actually happening in this client. And the reason for that is because these 3 points focus a lot on the practitioner or student's own awareness of what's going on. In other words, we have to develop the tool to pick up the information before we can get information at all. Okay? And technically we focus a lot on the information, but not so much on developing ourselves. So this DVD video and accompanying manual is trying to actually focus on these 3 steps to gather and develop an awareness within ourselves so that we can get the most out of our assessment process and put it together to help understand the client.